Thanks everyone for joining today's webinar from the SANS and Tommy's Joint Policy Unit to launch our Saving Babies' Lives 2024 progress report. Really appreciate the time you're taking to come to listen to us today. Please feel free to introduce yourself in the chat, and please, there's a Q&A, so please ask any questions in the Q&A. So we'll speak for a bit and there'll be an opportunity to hopefully run through some of your questions afterwards. So just to give a very brief background on the Joint Policy Unit. So back in 2022, SANS and Tommy's came together to establish our Joint Policy Unit. This unit was established to focus on achieving policy change that will save more babies' lives and tackle inequalities in pregnancy loss so that everyone can benefit from the best possible outcomes. So the purpose, the overarching purpose of all of the work we do in the Joint Unit is to focus on that policy change that will save lives and tackle inequalities. This is the second annual progress report from the Joint Policy Unit, and myself and my colleague Georgia will take you through some of the key messages and key insights from the report. And like I said, there'll be an opportunity to ask questions at the end. The purpose of the report, the purpose of these annual reports, is to summarise the latest data on stillbirth, neonatal deaths, preterm births from across the UK, but really to ensure that saving babies' lives and tackling inequalities are the political priority they deserve to be. The report brings together lots of different data and is very focused on data, but it's really important to remember that behind these statistics are individual stories of loss and the devastating impact they have. Earlier this week, we heard from the Birth Trauma Inquiry about the impact of birth experiences on families. This report and our focus is on the outcomes for babies, but it really does highlight many of the same themes as that inquiry. And in the main report, we've highlighted trends in mortality data from across the UK, but much of the health system data, so patient data and staff surveys, etc., for that main report focus on the situation in England. So this year we've also published focused on briefings for the devolved nations. So we've got briefings on the situation in Wales, Scotland, and Northern Ireland. And given we are in a year where there's a general election in Westminster, we really think this is an opportunity to highlight the need for there to be a much stronger political focus on saving babies' lives and tackling inequalities in pregnancy and baby loss. The report calls for a fundamental shift in our policy approach, one that recognises the scale of the issues facing maternity and neonatal services and of the transformational improvements that are required to save more babies' lives. At the moment, it doesn't feel like the current government has grasped the extent of the issues and the extent of the improvement required in maternity and neonatal services, and we'll highlight how we've come to that conclusion in future slides. But really, the overarching message from the report is that we need to shift. We need a much stronger, more comprehensive response from government, and a shift from focusing on issues as if they're individual outliers towards achieving system level changes. People might recall that back in earlier this year, back in March, the Health Secretary made a number of comments on maternity and neonatal services while on the BBC, and during the course of that interview suggested that problems with maternity services were only in some darker corners of the NHS and that the government was on track to meet its own targets. We'll talk about the targets in more detail later, but really it's that narrative that this report is trying to challenge. That we think a shift is needed from focusing on outliers to addressing systemic issues. And one particular area the report highlights this year is the funding commitments that government have made to improve maternity and neonatal services. The Department of Health and Social Care and NHS England have consistently highlighted that they've invested an additional 165 million per year since 2021 to improve maternity and neonatal care. And you can see on this slide, these are just a few of the examples of them using this figure, but it's a consistent response anytime that maternity and neonatal services are in the news, really. And also that this investment in the future will rise to 186 million. But just looking backwards to 2021, And even this week, in response to the launch of the Birth Trauma Inquiry report, ministers referred to this additional funding and saying that they're delivering record investment in maternity and neonatal services. But really, we thought it was important to put that level of investment into context. 165 million sounds a lot on its own, but without knowing how much is spent per year on maternity and neonatal services, it doesn't really mean a lot. So we assessed some of the data from NHS England, obtained some of it from a Freedom of Information request, but this is really data from NHS England's the returns that the individual trusts make to NHS England. So our estimate, and there's more detail of this in the report, is that in 2021, 2022, approximately £5 billion is spent delivering maternity and neonatal services in England. So that starts to put this £165 million additional per year into context. And as I'm sure plenty of people on this call will recognise, there's been quite a high level of inflation since 2021, 2022. So just to keep track with inflation for 1 year, maternity services would have needed an additional £453 million. To keep track with inflation from 2021 to 2023, they'd have required an additional 920 million and nearly £1 billion. So it starts to put that figure of 165 million additional into context. So the commitments that government are talking about in terms of increased spending are far below the scale required for the transformational change we think is required to support to improve outcomes. And the report also highlights how we think the scale of pregnancy loss and baby deaths is not inevitable. So at least this is data based on reviews following the death of the baby. So based on PMRT, perinatal mortality review tool reviews. So from those reviews, we know that at least 20% of stillbirths and neonatal deaths may have been prevented with better care. So that equates to over 800 babies' lives in 2022, 2023. So just to put that into context, 800 lives is 25 classrooms full of children. And saving these lives doesn't require any new interventions. These are lives that could have been saved just by delivering care in line with nationally agreed standards. And because this is based on reviews, and we know that reviews following the death of a baby vary in both their quality and completedness, it's likely to be an underestimate. So as we hopefully improve the quality of reviews, we'll likely identify more instances where improved care could have led to a better outcome. Over to Georgia.
In the report, we review recent trends in mortality data, and we can see from these that progress to reduce the rates of stillbirth and neonatal deaths is stagnating. So here you can see the latest UK-wide data from Embrace UK, which showed an increase in both rates in the most recent year, 2021. We can also see that there continues to be stark and persistent inequalities by ethnicity and deprivation. On this slide, you can see the stillbirth rate differences across ethnic groups. And the stillbirth rate in 2021 was over double the rate among Black babies compared to white babies. And the rate among Asian babies was over 50% higher compared to white babies. There are more and more grassroots advocacy movements drawing attention to these unacceptable disparities, one of which is Black Baby Loss Awareness Week, which is taking place this week. And we feel the government needs to really engage and listen to these groups and commit to reducing inequalities. This is just one example on the slide, but we can also see similar disparities in neonatal mortality rates between ethnic groups, as well as in both stillbirth and neonatal mortality rates based on socioeconomic circumstances. We can also see that in some areas, inequalities are widening. So on this slide, you can see the stillbirth rate among the most and least deprived areas in the UK. And in 2021, you can see that the rate increased in the most deprived areas and decreased in the least deprived areas. 2021 was just at the start of the period of inflation and higher energy and food prices. And there are concerns that these inequalities could widen as we see the impact of cost of living on families. And a survey of health visitors last year found that 93% found an increase in poverty among the families they visited. Targets were introduced in England to halve the rates of stillbirth and neonatal mortality, as well as maternal mortality, preterm birth, and serious brain injury relative to 2010. You can see from this graph that a steep decline will be needed to meet these targets by 2025. And ministers often speak of services heading in the right direction, and we frequently hear about a 30% reduction in rates. And while this is true in comparison to 2010 and recognises really important progress that has been made, a lot of this progress was from the first few years, and it misses the fact that progress over recent years has been much slower. So the stillbirth rate in 2021 was the same as the rate in 2017, and the neonatal mortality rate has only declined around 10% since 2017. There's also been little progress on efforts to reduce preterm births, which have remained at between 7 and 8% between 2016 and 2021. These targets expire next year, and it's important that there are renewed commitments beyond 2025, along with the funding and resources necessary to meet them. And we would also like to see the targets expanded to include an ambition to reduce inequalities. As Rob mentioned, this year we've also looked at briefings for Northern Ireland, Scotland and Wales. And in the individual briefings, we explore some of the data around the delivery of health services, as well as the overall mortality rates. We have to be a bit cautious looking at differences between the nations, partly because of differences in population size. So in smaller populations, we can see higher year-on-year variation. So in this graph, you can see the blue line for Northern Ireland has quite variable rates year on year. But these comparisons do help to point out where progress is falling behind. So here you can see the pink line, that the rate in Wales has been the highest out of all the nations since 2014. And there has been relatively little change over the past few years. Similarly, for neonatal mortality rate, the rate has been highest in Northern Ireland since 2013, based on mortality across all gestational ages. We can also see some specific trends, such as the year-on-year increase in Wales between 2016 and 2019, as well as the sharp increase in Scotland between 2020 and 2021, which was then subject to a review led by the Scottish Government. So we're calling for each devolved nation to set targets to reduce mortality rates, along with introducing a programme of work to achieve them. From our review, it was also clear that the devolved nations need to seek insights from staff and patients on a more regular basis. The final area of saving babies' lives, which we're not able to explore in more detail, is miscarriage. And the lack of data continues to limit our understanding of the number of miscarriages happening each year across the UK. In this year's report, we do discuss some of the work that's underway to improve collection of miscarriage data in Scotland, and we would like to see the other UK nations learning from those efforts in Scotland and committing to counting miscarriages more comprehensively. And counting is really the first step to understanding the scale of miscarriages and introducing interventions to reduce them.
Thanks, Georgia. I talked earlier about how the report really focuses on the fact that a range of systemic issues need to be addressed for us to make progress. And staffing is one of the most frequently raised issues when talking about the NHS. In the report, we show that the number of full-time equivalent midwives are growing, especially when compared to the falling number of births. However, we know that staff are still under huge pressure. So 2/3 of midwives reported feeling unwell because of stress in the last 12 months. 40% of midwives feel that only 40% of midwives feel they achieve a good work-life balance. And these headline full-time equivalent numbers do not necessarily reflect variation across services and the country or the changing profile of the birthing population, or indeed any additional requirements that are being placed on services. So the report really says that improving staffing levels are necessary, but on their own not sufficient, and we also need to improve a range of other things, including the culture in which staff work. And connected to culture is the extent to which staff listen to parents. So this is data from the 2023 CQC maternity survey. And while most people feel that they are listened to and treated with respect and dignity, the fact that 20% of respondents to the CQ survey do not think their concerns were taken seriously during labour is worrying. It's important to recognise at this point also that the annual CQC maternity survey doesn't include the voices of those who experience the worst outcomes. It doesn't include the voices of those people that have lost their baby. And we would want to see the CQC introduce a mechanism for better capturing the insight of people that have lost their baby and capturing their experience of maternity care. The report also highlights how too many stillbirths and neonatal deaths are occurring as a result of care that's not being delivered in line with nationally agreed standards. And there's unacceptable variation across the country in the delivery of maternity and neonatal care. The report talks about a range of different, goes through a range of different sort of data on that throughout pregnancy and the neonatal period. We've just highlighted in this presentation some of the differences in the adherence to neonatal care standards. So this is, here you can see sort of the difference in the level of compliance against care standards for preterm babies. So this is for different neonatal networks. And for example, the lowest level of compliance with deferred cord clamping is just over 40% in the worst performing neonatal network, compared with 80% in the most compliant network. And you can see in a range of these standards, there's quite wide variation in between the lowest and the best performing networks. So really the message from the whole report, from the whole period of pregnancy, neonatal care, there's too much variation, too often nationally agreed standards of care and not being followed. And as I highlighted earlier, too often this leading to avoidable deaths. Over to you, Georgia.
It's important that when things do go wrong, that lessons are learned and systems are put in place to prevent the same thing happening again. Action plans are developed as part of the perinatal mortality review tool, which is used to carry out local reviews of late miscarriage, stillbirth, and neonatal death. On this slide, you can see the ratings of those action plans, and we can see that too few action plans which are developed as part of these reviews are rated as strong. And strong action plans means that they focus on system level change rather than relying on individuals in the service to do the right thing. So while we can see that the number rated as weak, the proportion rated as weak has decreased over time, only 14% were strong in the most recent year. Another area is improving leadership and oversight. Board oversight of quality and safety has been frequently discussed in inquiries and reviews of maternity services. And last year, we reviewed publicly available board papers and minutes for 7 NHS trusts in England to analyse performance across these 3 areas. So looking at the information and data presented to boards, looking at how boards review that information, and then the actions that they take as a result. And in this diagram, you can see some of the factors that we looked at for each of those 3 areas. Our review raised questions about boards' ability to have a full understanding of the performance of maternity and neonatal services under the current system. We found that data was often presented in reports without context or analysis to help board members understand the implications. And there was a sense of boards being drowned in information with very long reports, which in some instances included graphs that weren't readable. And we found that board members did not spend time scrutinising or asking questions. Instead, meeting time was spent presenting the reports with few questions or clarifications. And from all the papers we looked at, we didn't find any actions that were taken to address any concerns. And this is an area that we will be looking to work at work on this year, and we're currently considering what resources we could develop to help boards to provide more effective scrutiny. Finally, we need investment in research, and this shows research funding data from the UK Research Collaboration, which covers public and charitable funding. And you can see from the dark blue columns that there's been a growth in investment in research related to reproductive health and childbirth between 2018 and 2022. We looked at this data to understand how much of this investment was spent on research related to saving babies' lives. And you can see that in the lighter blue column. You can see that that amount is growing both as a proportion of overall spending on reproductive health and childbirth, as well as total spending. But as a proportion of overall spending on research, reproductive health and childbirth research has remained around 2%. So there is a need to continue to grow this investment, as well as supporting improvements in the research environment, including supporting early and mid-stage researchers, improving collaboration across research disciplines, and increasing the representation of groups who are most affected by pregnancy and baby loss. One welcome change from last year is the NIHR Challenge, which will spend £50 million on research related to maternity disparities. So we'll be monitoring this work over the coming years to see what is funded, as well as whether it meets its objectives around supporting researchers from underfunded disciplines and early and mid-stage career researchers. And if it's successful in some of those broader objectives, it could have a wider knock-on effect, positive effect on the research environment for this area.
Thanks, Georgia. So to summarise some of the systemic issues that the report highlights and the things that are required to make progress, we need to listen to parents, support staff, learn lessons, ensure that nationally agreed standards of care are being followed, and invest in services. And to make that a reality, we really need to ensure this is the political priority it deserves to be. So whoever is in government after the next general election, this needs to be at the top of the political agenda. Without that political prioritisation and urgency, we're not going to see the transformational change that's required to save more babies' lives. The report that we've published is, as I said at the beginning, it's really a review of the data and the evidence. So we've pulled this together to be used as a resource both for us but for others. And we know it can have an impact. We've already seen actions taken by individual boards in response to the board oversight paper that Georgia was just talking about a moment ago. And we've used data from our annual report last year to provide evidence and insight to government consultations and inquiries. But a really important part of our impact is how the information that we provide is used by everyone else. So we want it to be used and useful. So please feel free to use any insight and data in your policy work and influencing, and also give us feedback on any feedback you might have on it, what you found useful, where you think sort of further explanations or explorations required. I've included my email address at the end of the presentation, and we'll share copies of the slides with everyone. But really, this is just a plea. If you want to come to talk to us in more detail about any of the work we're undertaking, then please don't hesitate to approach us. And I'm particularly minded that a lot of the data we've gone through in the presentation today has been focused on England, and we have produced briefings for each of the devolved nations. So very happy to come to speak to people in Wales, Scotland and Northern Ireland in more detail about some of the findings from those briefings. I just wanted to give a very short overview about some of the things the Joint Policy Unit is working on next and in the future. So as I said before, we really think that the government treating this as the political priority it deserves to be is essential for making progress in all of these areas, and we'll be looking to work with the next government, with colleagues in Sands and Tommy's, to put that on the political agenda, to make sure they have access to the key insight, data and evidence to inform changes needed to save more babies' lives. We're also at the moment working on an inequalities framework. So this is to try and make progress on some of the stark and persistent inequalities that Georgia outlined earlier in the presentation, and to develop understanding on the different drivers of inequality, but also some of the different policy solutions that might be used to address some of those different drivers. And we'll be talking more about that in the coming weeks and months. As Georgia mentioned, we've previously published a report on the level of board oversight needed to support improvements in maternity and neonatal services. We're very keen to develop that further and develop support for board members into the key insight that's available to them as to kind of the performance of their services and how that compares to others and how they can provide more effective oversight. We're also, the Joint Policy Unit is very new. We're starting to develop more and more content. We're going to be developing a new Joint Policy Unit web presence, which will include all of our data and briefings, policy briefings and policy insight in one place. But importantly, we're committed to having as part of that a new data hub. So we're going to bring together some of the data which we present on an annual basis into an online hub so that it's more, we're able to keep it up to date more frequently. We'll still do an annual report, but we'll be keeping the data up to date as it's published. So there's a central place that people can go to provide the latest data, not just on the overall trends, but some of the policy issues that we've talked about in the presentation today. And we've also developed some focused policy work on some individual areas where we've identified as particular progress is required. And it's basically from looking at other reports and inquiries and evidence that we've highlighted some specific areas where we think a particular focus is required. So at the moment, we're doing some work, for example, on maternity triage, particularly the consistency of advice given to people when contacting or being given advice on when to contact maternity triage. If you're interested in that, please don't hesitate to get in contact. We've got some work underway looking at the provision of translation and interpreting services, because again, that's been consistently identified as a theme in different reports. And also we've got some work to build on the analysis of funding that I presented earlier. There's a bit of more in-depth analysis of funding in England, but also looking at some of the funding of maternity and neonatal services across the UK and how that's changed over time. So as I said, if anyone's interested in any aspect of our work or thinks there's something we aren't doing which we should be doing, please don't hesitate to get in contact. And finally, I just wanted to mention that we'd recently published a call for evidence. So we want to hear from anyone with experience of maternity and neonatal services, whether that's as a user of those services or whether that's because you work in those services. My colleague Kaylee will post a link to this call for evidence in the chat. But this is really about asking people what needs to change to deliver safer maternity and neonatal services. To support this work, we've done a review of 30 different reviews and inquiries from the last 10 years across the UK and identified what we think are consistent recurring themes. So this call for evidence is not about identifying or re-identifying what the problems are. It's thinking about, given that we've identified these different themes, what are some of the solutions? What are some of the things that are needed to make progress against each of those themes? So like I said, Kaylee's popped a link to that in the chat, and we've had a really good response so far, but we want to help hear from as many people as possible from across the UK who've had experience of maternity and neonatal services and can provide insight into some of the policy changes needed to make progress. So like I said, that's my email address. Please get in touch if you've got any questions, queries about this presentation or the work of the unit. We're very happy to talk to anyone.